Well, it's day 2 of this year's Mammothon at Roswell Park, and so far, so good.
The goal is to encourage 550 women to schedule a mammogram by the end of the day tomorrow. And our Jackie Walker is at Roswell Park right now in Buffalo to explain more. Jackie.
I'm happy to tell you, I have just heard that we are about within 100 appointments of our goal, and we don't have all the numbers in. So we are climbing, and you are responding and making those calls, and that's exactly why we're here. This is day 2, the final day of our Mammothon, and our whole goal is not to ask for money, nothing like that. We're asking for a little bit of your time to make an appointment for yourself to get a mammogram. If you are a woman age 40 or older, you should have one every year. With me now, as you know, and you have met her before, this is Dr. Ermelinda Bonaccio. She is the head of radiology here at Roswell Park. She is the woman who diagnosed my breast cancer 11 years ago, and so she's one of my favorite people on this planet, and you can understand why. You know, doctor, we've been throwing around the word mammogram, mammogram, get your mammogram all this time, and it occurs to me that some people don't know, understandably, what is a mammogram?
So a mammogram is a specialized type of low-dose X-ray that was designed to image the breast, to take a picture of the breast to find breast cancer. And there are multiple studies which have shown that it finds breast cancer early enough that it lowers your risk of dying from breast cancer.
Okay, right away you said it's a low-dose X-ray, and right away I can hear the ears perking up out there saying, that's radiation. Yeah. I'm putting radiation in my body. What about that?
And there's a lot of false information on the internet right now saying that it can cause breast cancer, not lower your risk of dying breast cancer, which is simply not true. It's very, very low dose that will not cause a breast cancer, and as we've said, can save your life.
And we say it can save your life if it's detected early, if your breast cancer detected early. Why is that important?
Well, we know that early detection lowers your risk of dying breast cancer. Patients who are diagnosed with stage 0, stage 1 have an almost 99% survival rate. The more advanced breast cancers, the survival rate is not as good. Now, we still have a lot of good treatments for breast cancer, even for the more advanced breast cancer. So that, we're progressing on all areas of treating this disease.
And we've talked many times, most mammograms, if you come to get a mammogram, most of the time it will be normal. Sometimes it's not. That was my case as well. And you, Dr. Bonaccio, are one of the people who would tell a woman that she has cancer. You told me that I had cancer. And I'll tell you something I've never told people before. When she told me, I was at work. It was in between newscasts. And because the newsroom is not a private place, I went out to my car. I sat in my car and took the call, and that's where she told me. How hard is that to tell someone they have cancer?
It's hard. What I do take comfort in is, when we detect it early, but just knowing that we have so many options for breast cancer treatment. Breast cancer treatment has gotten so much better. It's targeted. More women are surviving breast cancer, and I know that when I've diagnosed someone with breast cancer, I know I'm changing their life, and that's really hard to do, but I also know we have this wonderful team that will take good care of her and will get her through the journey.
And you see what she offers? She offers hope, and that's what she offered me. 11 years later, here we are, very dear friends. So this is why I'm appealing to you. Make that call. I made the call. It's 1-800-ROSWELL, or you can use the QR code on your screen to make the appointment. We'll be back in another half hour with more information for you about our Mammothon. We'll send it back to you.